way you come at it. He comes at it with government control. I say let's go at
government
it with
makes the
free
rules.
market
Are you
control.
suggesting who would make the rules? In other words, if without rules, people cheat, right? And we watch that with the banks. We've watched that with the car companies. We don't want to continue a process of basically people setting the rules in Washington to allow private interests or special interests to cheat and take money. Whether it's the health insurance companies, the banks, or a car company, it's unclear to me why his suggestions to try to prevent cheating or exploitation are dissatisfactory. If the government's not going to make rules, who is?
Well, and there are bills out there that would address specifically what you're talking about. The Shattuck bill, which is there that would address some of these market reforms that are needed, is one that gets to the heart of that problem, gets to the competition problem, allows people to buy that insurance that is needed across state lines, gets rid of some of those barriers, so those options are there.
Yeah.
When you look at the public option approach to this, the problem is there is not a government-run program that has actually brought down the cost, that has actually removed access restrictions. And for those of us that look at the history of public option plans, we look at that and say, well, everything that we see is going to drive cost up. That was one of the lessons from the Tennessee plan. The cost quadrupled within just a matter of a few years.
Isn't that because there was no other meaningful insurance? In other words, when you have the mandate but no insurance reform, all you're doing is mandating making insurance companies richer. Ezra, I know you got a question.
Sure. Hey, Congresswoman, thank you for being with us. You know, you tend to hear the path of bipartisanship of being one of subtraction here, right? If they take out the public plan, if they make the subsidies lower. But last night the president began to talk about addition, possibly malpractice reform. Is there anything the president could add to his bill that is not in there now that would bring Republicans on board? Is it malpractice reform, a cap on the deduction for employers? Is there anything that could be brought into the bill?
You know, I'm not certain that at this point saying, is there anything you bring into the bill? I think the appropriate question and what we would like to hear is what is going to be the basis for where we start, how we enter into this. Is it going to be addressing those needed market reforms, portability, the malpractice insurance, liability issues that are there? And that is why eventually you say, look, we need to stop, we need to start over, and we need to go about this in a different way. One of the lessons of August for all of us should be, as we have been through these town hall meetings, as we've had people come in, some that agreed with us, some that disagreed with us, what they have said is we need to address this, but we do not want government bureaucracy on top of insurance bureaucracy. We don't want health care to cost more, and we don't want it to be more complicated. We want to be able to manage this ourselves. And it is a deeply personal and deeply emotional issue for our constituents. And that's why I think we would be well served to say, look, let's go back and let's do this in a different way.
Right. But you would ultimately have the government set rules to prevent insurance companies from exploiting people to make money, correct?
You're going to have to go in and look at some market reforms. There again, you've got to make certain that you don't have a series of mandates and rules that prohibit free enterprise, that you end up eventually with fewer companies instead of more. And one of the problems
what about a law that prevents people from dropping? I mean, we'll go on. Well, I got a limited amount of time. It's my fault, Representative.
Yes.
I'll see. So I'll let you enjoy your day. We'll go all day. But thank you so much to reiterate that.
Listen, thank you. And there are ideas out there for risk pool reform. We're looking forward to the debate.
Wonderful. Thank you.